If you're a long-distance caregiver, you are definitely not alone. There are as many as 7 million people in your same situation, and each of us has developed a system to manage care long distance. But that support system changes when your loved one moves into a nursing home. Diane Reynolds from FHL Care Management has joined me to talk about how caregivers can help manage nursing home care from a distance. Thank you so much for joining me. So let's first of all talk about what percentage of nursing home residents actually have their primary caregiver in another city.
Well, that has increased significantly over the years, and in my experience, it's happening a lot more now than it ever did. We live in a mobile society, and more families are noting that they're having a lot of geography between their loved ones and themselves.
And so that relationship then that those caregivers have to have with a staff member or staff members of a nursing home facility is critical, because that caregiver, that family member, is not walking in the door every day.
Correct.
How key is that, and what do you do to start to develop that relationship?
Clear communication. You have to establish lines in the beginning and work with the staff. They're in partnership with you to help you to take care of your loved one.
I imagine there are some challenges, though, just being a distance away. How do you navigate those, and what are some of the challenges you've heard of that people have?
I think the biggest one is if you can start in the beginning when the person's first admitted and meet the staff, if you're able to be there. If you miss that time frame, then later, being able to talk with them, get the names of people, write down their position, what they do, find out from them how you best can communicate. Is there a specific person that's designated to provide reports for you or to be able to help you? And what's their role? When is it convenient to call them? If your time frame is different than theirs, if you live in California or another country, then you want to make sure that you're able to call them at a time that's convenient for them.
And do you find that folks communicate by phone, email, text? I mean, are they using all the communication methods that everyone else does?
It's changing. It's getting much more. There are a lot of privacy issues with having texts and things, so you really have to ask the facility directly which means are best. Some of them will provide you with an email, and you can then give them questions that you have, so you can get them answered easier, and that way it can fit in with their schedules.
So let's say a health crisis arises. What can the family do to stay connected in that sense? Where I imagine, you can't talk to them, every moment of the day, and 5 minutes can seem like an hour. And when you're waiting.
It can. Well, you want direct information. Then you need information in a timely manner. So whatever means of communication, either by email or by phone, to tell them these are the questions that I have, and what information you need. It's best to keep a notebook and write it down. I talked to such and such yesterday, and this is what they said, what is happening today, and gathering the information.
But you're probably speaking to more than one person. What if that information isn't jiving? What if it's not fitting with maybe what you heard yesterday, or you're starting to get different stories? What can family members do in those cases? In
those cases, typically you want to find someone that can give you the correct information, being it the social worker, charge nurse, or someone like that can give you clear information on what is happening, and let them know there have been some differences in the information, and you just want to clarify it. I think being respectful of their time, thanking them, and also, if someone gives you really timely information and has been helpful, maybe jotting a note to their supervisor saying what a good job they did helping you. It keeps the lines of communication open.
Is there any recourse, I guess, that family members have, or anything they can do if they really don't feel like they're getting the response from staff members that they want?
Well, I think you need to, again, make it very clear that you're not getting helpful information, you're not getting information that is timely for you. And then make sure that that you're speaking with someone in authority so that they can help to clarify it for you.
And these facilities can have family meetings, times when you maybe will be in town, correct?
Correct. They're required to have care plan meetings, which are usually 15 minutes every couple of months. That's required. But then family meetings can be called. Those are really helpful because you can connect people who are in other areas. So in other words, family members from all over can call in. And you can tell them ahead of time, tell the person arranging it ahead of time, I'm concerned about my father transferring. Could we have the physical therapist there? And so you can make specific requests to have specific staff there, and that way get your questions answered from the person doing the work with your family.
All right. Well, Diane, thank you so much. Very, very important information. And the key is to make sure that you get those connections with the staff members right off from the beginning.